Hello everyone, I am Arunkumar Kannan from the University of British Columbia, Vancouver, Canada. I am going to present our paper titled Leveraging Voxel-wise Segmentation Uncertainty to Improve Reliability in Assessment of Pediatric Dysplasia of the Hip. To provide a brief outline of the paper, quantifying uncertainty of the neural network is crucial for improving the trust clinicians or doctors have in the automated systems, such as disease prediction or prognosis and its management. Especially in systems involving segmentation tasks, quantifying the level of confidence of the model could provide meaningful information such as the model's uncertainty, which will be helpful in subsequent clinical pipeline. Therefore, in recent work, we proposed an interpretable uncertainty measure called metric variance that can be augmented with neural network output or prediction to help clinicians in assessing the reliability of developmental dysplasia of the hip, otherwise called as DDH, metrics measured from 3D neonatal scans. But we have not provided any confidence or uncertainty measure associated with the segmentation process. Hence, in this work, we propose a technique to quantify voxel-wise segmentation uncertainty of the neural network in which the measure can be further incorporated into the loss function used in training scheme that would have the network to focus on its least uncertain predictions. Give a brief background about the orthopedic disorder. Developmental dysplasia of the hip is an orthopedic disorder that primarily affects newborns. This is a condition characterized by hip joint instability, in which the femoral head of the neonate will be slightly dislocated from the bone socket. One of the serious problems in the management of DDH is its high misdiagnosis rate, which subsequently leads to significant unnecessary suffering at later stage of life. In the current clinical system, DDH is diagnosed by 2D ultrasound scanning of the neonatal hip. But 2D ultrasound's poor reliability in diagnosing DDH results in misdiagnosis. Hence, 3D ultrasound has been proposed as a more suitable imaging alternative for DDH assessment. Our lab has proposed and developed techniques for early screening of DDH using 3D ultrasound. One of the contributions is Quadar et al. Proposed to use hand-engineered features of 3D ultrasound like confidence-weighted phase symmetry to extract ilium, acetabulum, and femoral head in 3D ultrasound. Later, Hariri et al. Showed that deep learned features outperformed the hand-engineered features in localizing the ilium and acetabulum surfaces. Though these techniques have been proposed for managing DDH, clinical deployment of these automated systems remains a problem, since the system do not have the ability to report its confidence level which the end user or surgeon require to place trust on the system. Especially for diagnosing DDH, accurate and reliable segmentation is required for the following metric extraction process. But such segmentations are difficult due to high level of spectral noise and lack of ossified structures. So we need to develop a system that can automatically perform the segmentation as well as identify and alert the user when errors in segmentation are likely. One approach we can propose to address this problem is to provide some measure of the confidence or certainty of the prediction to the user at test time. Such certainty measures could help the clinician make a decision on the acceptance or rejection of the system as well as allow a faster review process, as it will enable the clinician to pay special attention to high uncertainty areas. In this work, we propose a technique to quantify the model or predictive uncertainty in the segmentations produced by 3D unit used to segment the bones in 3D ultrasound scan. In addition to estimating the segmentation uncertainty, we We also propose to propagate the uncertainty information back to the network to improve its prediction accuracy. We perform this by adding a voxel-wise variance measure to the loss function of the network in order to encourage the model to focus on its least certain predictions. In this slide, I will give a brief overview about the methodology of our proposed work. Our dataset includes 3D ultrasound scans of the neonatal hip scanned by a radiologist or a pediatric orthopedic surgeon under appropriate ethics approval and informed consent received from their parents. To diagnose DDH, we need to segment the ilium, acetabulum, and femoral head in the acquired ultrasound volume. Here, we use a 3D unit architecture to do the same. Furthermore, to calculate the uncertainty, we added a dropout layer at the end of each encoder and decoder block in the architecture. First, during the training process, we feed forward a 3D ultrasound volume to the deep network to segment the required bones. By Monte Carlo dropout sampling technique, we feed forward the sample multiple times to calculate the mean and the variance associated with the samples. The mean and variance of the sample is then encoded into the binary loss function to make the network to focus on its uncertain predictions. In this work, we use a modified loss function for optimizing model parameters or weights of the neural network. We generate 8 Monte Carlo samples during the training process for each ultrasound volume. From the obtained Monte Carlo samples, we calculate mean segmentation map defined as y cap and voxel-wise variance v. Now the calculated mean and variance can be encoded into the loss function. We use a binary cross-entropy loss function here, in which n represents the total number of voxels, yn is the true voxel value, and yn cap is the predicted voxel value at the location n. The aim of this loss function is to minimize the probability distribution between predicted and ground truth distributions. In simplest terms, the model assigns a higher penalty if it is uncertain about its prediction. We use this aspect of uncertainty information about the neural network and modify the standard BCE loss function by encoding voxel-wise uncertainty information. In this equation, lambda is a hyperparameter, which can be fixed by simple linear search. And Vn represents the voxel variance at n, and Yn is the mean predicted voxel at n. The intuition behind this loss function is simple. If the predicted variance of a particular voxel is high, the loss function nudges the deep network to focus on its uncertain predictions in the training process. The model parameters are thus optimized by minimizing the loss function. Here is a gradient of the loss function with respect to the probability Ym. We present our quantitative results of the proposed work here. To quantify the model reliability, we calculate the dice score, Jaccard coefficient, precision, and recall scores for the predicted segmentation. From the network trained with the standard cross-entropy loss function as well as the modified BC loss function denoted by L total. From this figure, it is clear that the dice score, Jaccard, precision, and the recall scores are higher for the network trained with total loss as compared to the BCA loss function. In this slide, we present our qualitative results, in which the first figure, or A, denotes the training label. B is the predicted segmentation of the network trained with BCE. And C denotes its corresponding uncertainty map. D represents the prediction of network trained with L total, and E represents its uncertainty map. From these figures, it is clear that the uncertainty voxels are significantly reduced in the network trained with the total loss function. This can be considered as a fine-tuning step. Also, it is clear that most of the uncertain predictions are localized in the femoral head. Since DDH metric extraction process relies on accurate segmentation, these uncertain voxels will result in erroneous DDH metrics. But the network trained with total loss function appears to suffer less from these issues. In conclusion, several methods have been proposed to date to address the problem of DDH assessment by developing automated tools, but those techniques have not provided any uncertainty indicators. Therefore, in this work, we address the problem by proposing a Bayesian-based model uncertainty estimation technique to quantify prediction uncertainty of deep learning-based segmentation of femoral head, ilium, and acetabulum. We demonstrated how such measures can be utilized to help the network focus its training on image voxels that are difficult to label and use these estimates to increase the segmentation performance. These improvements will likely make it easier to adopt deep learning based DDH diagnostic system in clinical settings. Thank you.